Thank you so much, Mary, for your kind comments, and it's a real pleasure and privilege to be here today to share with you some of the work that we're doing, which lies at the nexus of three areas: computational science, system science, and data science. So within today's talk, I've taken the liberty of actually modifying a fair bit of content as I've heard other material from other presenters at some peril to myself, and packed together a lot of slides, which I'm not going to be able to go through in great detail, but I'm going to try to emphasize the things that I think will speak to gaps in some of the discussions we've had, particular interests that have been expressed, questions that have been raised. And to try to address this, I'm first going to be talking about some motivations in the context of our work, so you have some sense about where we're coming from, some of the types of work that we do, and to actually tie it into this issue that's a theme here of social policy. I'm going to talk a little bit about this system that provides us with a lot of the data that fits in with the rubric of sort of big data, this IEPI smartphone-based app that we've been using, which has been widely adopted by researchers across North America for health behavioral monitoring. And then talk some about, with a particular emphasis on combining dynamic models, agent-based models most notably, with machine learning techniques. I circulate quite a bit in machine learning conferences and crowds, and quite a bit in system science crowds, and I often find that, if not solitudes, there's actually comparatively little overlap, comparatively little in the way of sort of joint work going on. There are important exceptions, but I'm going to be trying to highlight some specific ways in which our work is bringing the two together. And whether it goes by the term machine learning or computational stats, the ways there's really big opportunities for dynamic modeling by leveraging techniques there together with big data. I'm then going to, as time allows, talk about a couple of vignettes that raise the provocative question about whether sort of high velocity data we get associated with many of these electronic data sources, such as those from IEPI, are merely a luxury, something that allows us to build more grounded, more rigorous models, or whether they're a necessity for answering questions in a robust fashion in this area. And finally, I'll make some concluding remarks. And again, I'm going to be scaling my level of discussion to reflect the understanding of the audience, the questions of the audience. So you'll forgive me if I go very quickly over some slides and dwell instead on others. So the motivation for this work for us really lies in the ever more complex health and social policy challenges that confront us as a society and worldwide. These include syndemics of mutually interacting conditions, distressing gaps in the mental health area, and the need for a life course perspective to understand the full burden imposed by many health conditions. We know that there are really long shadows of early life insults, whether they're in utero exposure to diabetes, as much of our work is documented, or in work going back to Barker, deprivation in earlier life, setting oneself on a course for many later life chronic diseases. And we're dealing with a situation where health disparities are in many places growing even worse, and where we confront an aging population which has ever more extensive needs associated with it. All this in the context of corporate actors who are ever more nimble, such as tobacco companies who have such a big presence online and are seeking to influence behavior there. So our work has leveraged three components: system science, computational science, and data science, to try to address many of these questions. And I'll just be giving sort of slivers of insight into particular aspects of that research program. But we particularly for years, and for about 15 years for me, and specifically in the health area, 25 years more broadly, have been seeking to use simulations to inform decision-making. And most of the models that we work with these days for these rich questions are individual-based models, agent-based models that provide really detailed longitudinal and cross-sectional views of population's health, and let us reason about individual people's trajectories, the design of very detailed interventions, network effects, and let us calibrate to individual level data, et cetera. And these models typically are have quite an appetite for data. Often there's a need to estimate parameters which outstrips the availability of traditional data sources. And while these models can be very helpful for decision making, without the data to back them up, often we're in a position where our ability to offer quantitative insight to policy questions is really limited. So although my work focuses specifically, and has for the better part of 2 decades, on health policy, a lot of what I do has very close couplings with aspects of social policy and social issues. I would highlight our work, for example, with the Good Food Junction, looking at sort of the impact of co-located community-owned resources, grocery stores, and nutrition and social capital. Work with the Neurorelational Framework and infant and child mental health, looking specifically at this issue of how investments in the very earliest years end up rippling through on a cross-sectoral level, not just to health benefits, but to benefits in terms of reducing social service needs, enhancing child welfare, et cetera. And work that we're doing with our Ministry of Health and patient flows and hotspotting, and using models to understand drivers for and sources for ameliorating some of the long waiting times within Saskatchewan's healthcare system, where a lot of the issues are not merely health issues, but mental health issues, social service issues. And a number of other emerging connections, such as with the Ministry of Justice and Corrections on mental health. Now, a major barrier to this sort of work relates to the difficulty of acquiring information on a detailed level about a variety of important factors involving people's movement and location, physical activity, spatial proximity to each other, aspects of their social context as might govern transmission of knowledge, attitudes, beliefs, and factors related to communication. And we're very interested in leveraging techniques from the data science side to try to address these important areas of questions where our models have traditionally been shortchanged. So with that in mind, I'm going to talk a little bit about a system that we've been turning to for a lot of our recent data needs, and this is IFE. It's a smartphone-based platform built on top of the Android system. We've been using this for about 6 years now since we built it, just after the time of the H1N1 pandemic. This is our 2nd generation system. It builds on experiences and learning from our 1st generation system, and it uses commodity hardware, a fully functional smartphone that people are internally incented to carry, and it collects a wide variety of sorts of information, both self-report by individuals, responses to surveys, and a whole bunch of sensors. It's been adopted now by numerous partners from around, particularly North America, such as those listed here, for everything from studies of patients within facilities to aspects of nutritional behavior, to understanding the impacts of housing vouchers in New York City, to and as part of RCT's randomized clinical trial for communicable disease spread, sponsored by the U.S. CDC. We're also using it to look at factors such as e-cigarette use, depression and mental health, and factors that have some elements of the social science side to them. This is a system. Okay, there's a little bit of within the IFE system, we have elements of it running on the phones. Data is uploaded opportunistically to a server, and then we go through a variety of analysis tasks, which typically combine machine learning, traditional statistics applications, and agent-based modeling in tools such as AnyLogic or other simulation platforms for analyzing the data and linking it to decision-making. A key emphasis of this system has been on adaptivity, where we can adapt the system to totally new uses with a minimum and often with no programming actually being involved. So areas of keen interest in our data collection here, areas in which it excels, not surprisingly map onto these areas where I identified there as being gaps for some of our data for building our models. And this reflects the fact that IEPI can collect information from a wide variety of sensor modalities, things that you folks will have heard about earlier in the day, Wi-Fi, GPS, compasses, magnetometers, accelerometers, but also things to give a sense of interpersonal context, things like Bluetooth, by which you can detect the relative proximity of different participants and some non-participants. And importantly, we couple and cross-link this sort of sensor-type data with data gathered through on-device questionnaires, these micro-questionnaires which can be triggered at random times of the day in classic ecological momentary assessment type fashion, or triggered by specific contexts. So, for example, when you're in a crowd for our RCT involving sequestration, or when one has appeared in a park to trigger a questionnaire related to use of recreational spaces. And then finally, we have the capacity to sort of crowdsource information through the system through button presses. So using a system like this, we can map people's movement over time, where they spend their time. We can localize them indoors through techniques based in Bayesian analysis of likely position from trilateration based on signal strengths of different routers, for example. And we can map out contact patterns as they change over time. I show here week 1 and week 2, but we can do that on a multi-minute basis, and we have. We can also look at things that are very burdensome to gather through traditional self-reports involving the duration of those contacts, which is useful for understanding transmission of norms or transmission of pathogen. This is a system that prizes ability to easily customize it, and the user interface sampling regime questionnaires can evolve in a very straightforward way from study to study. So, for example, we can set up studies with ability for the user to indicate particular exposures of interest. Maybe it's tobacco-related messaging. Maybe it's the fact that they're near a fast food restaurant. Maybe it's the fact that they're feeling the air quality is poor, or they're coughing and wheezing. Or they may report, for example, that they're taking insulin or testing their blood glucose. So from study to study, which particular sort of crowdsourcing components we include will vary, as will the questionnaires. And this can be changed during a study or between studies without programming. So using a system like this, one of its big strengths is one of the V's of big data that you'll sometimes hear talked about. The 4 V's being volume, often the thing that's most emphasized. Velocity, the data is coming in really fast. Variety, which is related to the fact we're collecting lots of particular types of data, and to a certain degree, veracity, in the sense that we can collect things with physical measures that are often less subject to participant recall bias, etc. So we can map out activity level over geography. We can look at where social interactions are taking place geographically, map out where people are congregating within spaces inside a building. And we can cross-link this information, and we do in very important ways, with other types of electronic data sources. For example, weather reports to understand impacts on people's mobility or contact patterns of adverse weather. I'm from a city which exhibits a certain measure of seasonal variability in weather. These types of variability are believed to have a substantive impact, and evidence suggests that they do on people's behavioral patterns. GIS databases related to service availability and location, environmental sensing systems that pick up things like air particulates or nitrous oxides, etc. So using a system like this, we can map out, for example, in people's empirical activity spaces, what are the services into which they come in contact. So for individuals on our east side and our west side, we see quite strikingly different levels of exposure, for example, to things such as the parks, such as grocery stores versus convenience stores, which can have a material impact on health behaviors, nutrition habits, physical activity. foremost goal for all of this has been security and confidentiality. And we invested long before we started building the system in a dialogue with our ethics boards as to what was acceptable, what was pushing the boundaries, what could be possible under different contexts. And so we've provided for years a snooze option for snooze data recording for the sense data when the participant wants us. And that allows us to distinguish between, on the one hand, cases where somebody wants privacy, and on the other hand, a case where someone is simply forgetful in charging their phone or leaves it at home for other reasons, which is a very important thing to be able to distinguish. We also have extremely strong on-device encryption that uses two different encryption methods, DES and RSA, to add extra levels of strength, to the point that me, as one of the two people who guided creation of this device and has been involved in programming it, is not able to crack the encryption myself, even given months of effort. And there's an extensive and often tiered informed consent process that we go through to when people opt into our studies. The key constraint that underlies all of this, or a key constraint certainly, is energy. This is probably the foremost of them. The fact is that measuring sensor data and keeping the phone on to ask questions takes energy. And there's limits as to the rate at which we can gather, for example, accelerometry data without shortening the battery life to the point where compliance is adversely impacted. So we've been fortunate to ride over the years, a half decade or so, that we've been using this system, what's called Kumi's law, which is a close relative of what's the more widely known Moore's law. Moore's law is running into quantum difficulties at this point, but Kumi's law continues in full stride, and it's associated with a log linear type of situation where every few years we double the energy efficiency of our devices to the point where our devices now can last longer on a given level of battery compared to our devices in the past. So I don't want to dwell on this too much, but the types of data we get out of IEPI, the intensively longitudinal data, the fact that we can cross-link so many types of data and that we can get a great temporal resolution provides a lot of grounding for our agent-based models that depict micro-behaviors. They allow us to take out of the realm of speculation understanding of the interaction, say, between physical activity and food consumption, or between sedentary behavior and physical activity, or between the use of different nicotine options, say e-cigarettes and cigarettes, and allow us to actually observe these things and collect that sort of data in real time through the day. And we've used this for a wide variety of purposes in our studies. But the main point for me to get to you for this talk is that this provides and underlies many of the types of analysis I'll be talking about next, bringing with machine learning and dynamic modeling. Increasingly, we see the future state of something like IEPI as being mass-scale downloads by individuals, and we've got provincial ministries of health very interested in this model, where basically participants use IEPI as an app on their smartphones, can opt into certain types of data collection, potentially with compensation for health data, or on a retainer basis where data is stored in escrow until and if it is needed, say in the context of an outbreak. So as a whirlwind sort of glimpse at IEPI with an eye towards talking about, when I talk about us using big data, this is the sort of thing I mean. The data from sensors, together with micro reports by individuals, crowdsourced as well as in response to survey data, cross-linked with external data sources such as external sensors like weight scales or weather data, etc. Okay, so given this sort of data is available, and given the fact that our agent-based models are articulated at a micro level of detail where we depict individual bouts of smoking or individual cases of presentation for care in a healthcare facility, how do we bring those two together? And really, this is what I wanted to emphasize a little bit more in this talk. What are the sort of modes of meshing this sort of big data on one hand and our dynamic models that we're using for years and decades to address health and social policy challenges? How do we bring those two together? And we'll talk about some ways that we are addressing this challenge. And I'd note that all of this is in the context of sort of a technology stack, a set of technologies which build on each other for making sense of this data. So when we have this data coming in, it's at a level of temporal resolution and specificity in terms of the measurands that cannot be simply fed into dynamic models. Instead, we need to go through a series of levels of analysis before the dynamic models involving, for example, signal process and learning, inferential models that allow us to arrive at a robust understanding of the patterns being talked about. And I don't have time to go into all of these in detail. We've looked at a variety of types of models, typically based in Bayesian approaches. But I do want to talk about some specific ways that they couple with simulation models. So I don't think, given our previous talks, I don't think I need to talk about simulation models to characterize them as a class, but rather to spend that time emphasizing how this comes together with data such as from the phone sensors. So broadly speaking, I've listed up here a half dozen or so different ways in which dynamic models help complement sensor data in ways that sensor data help complement dynamic models. And I'd like to spend a few minutes on this slide. So broadly speaking, and this is a phrase someone else used this morning, which I really liked, that dynamic models are basically involved in making sense of the data and particularly linking it up to counterfactuals. Data is great for the situations which have been observed, but often we try to understand what's the implication of that data for situations that have not been observed, for example, novel interventions. And dynamic models provide a key link in this process to take that data and help make sense of it for the implications of decision making. So dynamic models can help us capture the hypothesized processes that we posit to underlie this sensor data, and they can be involved after we've sort of appropriately calibrated them or linked them to this data with understanding counterfactual situations by asking these what-if questions that are routinely the subject of dynamic models. But these sorts of dynamic models can also be used in a very valuable way to filter noisy sensor data, to take sensor data which has known noise properties and to work to sort of condition it so that we have more reliable insights from that data, more reliable data understanding derived from that data than by the data itself. This is the province for many types of data behind the scenes, such as on your smartphone for Kalman filtering, for example, where with a Kalman filter, we take the incoming data and we, through a certain statistical model that dates back to the 1950s, we apply conditioning to it to arrive at a more reliable estimate of location than any one data point would give you. And we're extending that to dynamic modeling using techniques I'll talk about. Dynamic models also help us to understand the proximal and distal implications of this sort of collected data by allowing us to sort of say, well, okay, if we run this forward, what might the implications be for caloric consumption of the observed levels of physical activity, for example? It can help us in some cases filling the gaps between sample data points in terms of temporal continuity. And very importantly, it can help identify sampling rates that are suitable. And we'll see this in my vignettes. Dynamic models can help us figure out how frequently we need to sample certain data to get reliable understanding of the sorts of research questions that we're interested in. And finally, dynamic models can serve as a potent source of synthetic data for testing machine learning models, which is something we've used quite a lot in our work. Sensor data, by contrast, serves a role in grounding these dynamic models in high-velocity observations, in high-variety observations, and it provides databases for model parameterization and calibration, in using that term in a broad sense, and for stimulating dynamic hypotheses. So, at a broadest level, I think of dynamic models, okay, this isn't showing up, models as thinking tools. Dynamic models help us think through, in a consistent way, the implications of certain assumptions about how the world works, and let us find inconsistencies between those theories and what's actually observed more quickly. So they help us make sense of evidence more quickly by seeing if our hypotheses about the processes out there jive with that evidence. Do they line up? Are they consistent with that evidence? So basically, I think of models as kind of a learning prosthesis that complements our limited ability in our heads to think through the implications of a set of carefully articulated theories. Instead, it puts us into a model which just operationalizes those theories and lets us run it and see what the implications are much more reliably than we could do in our head. So in that context of models as thinking tools, these sorts of observations from big data help us deepening our learning from interventions in a fundamental way. So for example, with the big data, we can take observations about the nature of what it is about a move from a mixed income neighborhood, from a low income neighborhood to a mixed income neighborhood, and why does that positively affect, what does that affect obesity levels by lowering obesity rates among teenage girls? We might be able to unpack that into several hypotheses involving different pathways of evidence, or different pathways of effect, and then use evidence to help us understand the degree to which different pathways are in fact exercised by this observed move, compared to some control group or compared to the pre-intervention baseline. And so in this case, we might, for example, use measure data to evaluate which pathways are improved, and compare that with understanding of what we'd expect from a model, and use the results to identify shortcomings in the model, and use this refined model to evaluate ways to improve the intervention, to for example, have a more successful intervention that might help compensate for the fact that when you increase moderate to vigorous physical activity, potentially sedentary behavior can also be increased. And we might, if we see that this pathway partly counteracts this one in terms of its impact on obesity levels, we could formulate an intervention with a model that would help us address this pathway. So data from sensors can help us figure out which pathways are operating more strongly. By comparing them to a model, we can better craft our understanding about how we think changes out there affect things when we undertake an intervention, and we can use that to improve the intervention. At a highest level, this is one use of models, but I want to talk about several additional uses that are rooted in machine learning. And I'd like to talk about how we're leveraging that combination of dynamic modeling and machine learning jointly to provide model results that are more robust, dynamic model results. So there's several techniques that we've used in this process. They vary from very widely used techniques such as Markov chain Monte Carlo and increasingly particle filtering or sequential Monte Carlo methods, to techniques that are less widely used but I think are really promising, such as particle MCMC. I'm also going to talk a little bit about a critical part in our technology stack that plays a big role in grounding our model, which is state inference. And I'm going to actually start with that one because it's the most straightforward one. So we make use of a variety of machine learning techniques to classify behavior as received from big data, as received from data from IFU, for example. And these needs are often focused on health behavior. So, for example, classifying whether someone is smoking or not, whether they're engaged in sedentary behavior or not, whether they're engaged in active transport or vehicular transport. But one of the most key ones that extends to virtually all studies that we pursue is whether the phone is in fact on person or off person. Is this phone being carried by someone? If it's not being carried, the data that's being collected by it, while voluminous, probably will offer very limited insight into health behavior of the owner. On the other hand, if it's on person, we can learn a lot about the context, a lot about their behavior right now by observing that data. So in a type of analysis that's quite fundamental to our work, we use hidden Markov models to classify whether someone is carrying the phone off person or on person, whether it's in fact with them or perhaps sitting on a desk. And we use a variety of types of measurands from the phone things like acceleration, the accelerometer data, whether or not the phone is plugged in right now, to help judge which state that they're in. And I don't have time to go to explain the theory of hidden Markov models, but I will say that this is extremely important for creating a data set which will then underlie our dynamic model, allow us to, for example, derive parameter values for how quickly someone switches from one state to the other. Say if this is sitting and this is standing, or if this is engaging in smoking behavior and this is not engaging in smoking behavior, how often they're smoking, for example. So this state classification is quite fundamental to a lot of our work, and it allows us to deduce certain types of parameters, such as transition parameters between states that go directly into our model, and say in a probabilistic model. So it might reflect people's movements between different types of health behaviors that we could recognize empirically. Those go into the model as transition hazards, as likelihoods per unit time, and we would then use that model to examine the impacts of interventions, for example. And this data can furthermore provide data that not only parameterizes the model, but data needed to calibrate it, to sort of match model predictions against observed time series, either at a longitudinal level or across the entire population. This is one example of another type of classification technique based on support vector machines to classify, for example, smoking behavior from non-smoking behavior. And we've seen actually remarkable levels of accuracy made possible by machine learning models for that problem. So be aware that state inference, inferring what someone is doing, classifying it, has been one of the major ways we've taken data from the phones and related it to the dynamic models, either for parameterization or calibration. Another technique that we're performing a great deal is the use of Monte Carlo, Markov chain Monte Carlo techniques together with dynamic. We have a dynamic model, and for simplicity, I've shown this with an aggregate model, an SCIR model, characterized by differential equations here. And I would note that this is a nonlinear model, so in general, there's not a closed-form solution for such models. And we might have some observed data over time with some posited data behind it that's unknown. And using a Markov chain Monte Carlo technique, one can derive and sample from estimates for parameter values that might not be well known or well measured, for example. In this case, for example, C, the contact rate, the number of contacts a person in this population has per day, say, and conversely, a probability that a given person, when entering the infective state, will be reported to the healthcare system. And in order to do this, one could pursue it in a Bayesian fashion. By Bayes' rule, we can derive a formulation that gives a function here, giving the probability of a given set of parameters, theta, given the observables, y, that data that was coming in over time here. And using that, okay, now this is getting a bit truculent, and we can have some prior here for the different values associated with these parameters. And using this formulation of the posterior probability, it gives us the necessary hints that we need in order to arrive at, through Bayes' rule, a formulation of this in a Markov chain Monte Carlo sort of way. So a key component we need is this likelihood function, the likelihood of observing certain empirical data given a certain set of parameter values, and that will actually be drawn typically from a process that will involve running the model, running the simulation model. So, for example, we'll run the simulation model over time with a given set of parameter values as sampled by MCMC, perhaps as a candidate set of parameter values. We'll run it. We'll see how many people, for example, are undergoing what's the incidence rate at a given unit of time, and then we'll reason using a probabilistic model about the likelihood that the observed data would have been observed given the posited incidence rate for those parameters as gained through running this model. So in this case, as part of the MCMC, and as part specifically of our likelihood function here, we are actually running the simulation model, this dynamic model, taking its output, feeding it into a probabilistic model that allows us to evaluate the likelihood. We could then combine that with the prior to arrive at a value proportional to the posterior. And for example, with a given model, this was just pulled out of one of many presentations I've given for particular models, we might sample C, this context per unit time, and P, this chance a given case will be reported. And by sampling it using MCMC, we might find that there's a posterior distribution across the two of them that's implied by the empirical data and the model and the dynamic model and the probabilistic model. And we can examine the impact to which a different prior distribution affects it. So this is a very promising technique involving MCMC, dynamic modeling to make sense of incoming data that we've made use of in a variety of circumstances. And using the samples from the parameters that are arrived at by this, we can then sample values for the underlying states, the values of the state variables, for example, and we can look at distributions over time for the that are implied. So these are samples from posteriors associated with the difference between the baseline and in some counterfactual intervention case. And we can see the difference that would result from this particular intervention, not as a point estimate, as you traditionally get out of a deterministic model, but instead as a series of posteriors for different points of time. So MCMC together with dynamic modeling. A second technique that we've used even more broadly is a combination of particle filtering, a sequential Monte Carlo technique, with dynamic modeling. And this technique is particularly useful for stochastic dynamic models, which are typical for agent-based models, and provides us a way of estimating, among other things, the latent states of those models, as well as gains through interventions. So in our case, much of the motivation for this has been in dealing with fast-evolving outbreak situations, but it's not limited to that. So when we have a situation where there's some emerging outbreak, perhaps some new pathogen such as SARS or such as H1N1 swine flu, where we don't really have good estimates at this point for the parameter values associated with it. We don't have the luxury of having studied it for years and years and years. We still will often have a very urgent, even dire need to plan ahead. In our health region, as well as many other regions around the country, are very interested in techniques that allow them to respond adaptively to these types of situations. And, the reflection here is that often in these times we really need models. We don't have the time and the luxury to build a very, very large, articulated, and closely calibrated model because we don't have the data on which to do it. And moreover, even the most detailed model, through stochastics, because of omitted factors and inevitable inaccuracies in the model, will eventually diverge from the empirical situation. We can build the best model now. 3 years from now, it may be becoming increasingly divergent with the reality. So what we're interested in doing is creating an adaptive model in this context. A model that will be quickly available for decision-making and will be recurrently regrounded as new data comes in to make it more accurate, to improve its ability to track the situation with all the uncertainties that involves. It needs to take into account uncertainty associated with the model, to be sure, but also uncertainty associated with that data, which is going to be associated with sampling variability, and uncertainty as to the reliability of diagnoses, etc. So we're seeking here to rely on empirical observations as they come in to cross-check and to correct model predictions, with the idea being that the model is kept current with the latest evidence. And one way to accomplish this that we've drawn heavily on is the use of predictor-corrector methods. So we've made quite heavy use of two methods. A traditional method that I mentioned earlier that dates back to the 1950s in the work of Rudolf Kalman, which is seminal in avionics and real-time control applications for planes, missiles, rockets, etc. But then, more recently, this technique known as particle filtering, which is based on sequential Monte Carlo methods. And I'm going to particularly highlight this technique for two reasons. Reason one, it's more general than Kalman filter. Kalman filter imposes some quite strict constraints in terms of the assumptions about statistical variability, particularly in measurements and process noise, the uncertainty associated with the process as well as the measurements. But also, Kalman filtering imposes very strict restrictions on the nature of the model. It assumes that it's differentiable, that you could take a Jacobian matrix of it. And particle filtering has no such encumbrance in terms of its assumptions. With particle filtering, we're going to be computing a posterior over states at a given point in time, and it has quite flexible distributional assumptions. We're going to be specifying a likelihood function for having observed certain data given the underlying model state, and there's no differentiability or linearization sort of assumed for it. So it can be applied, and we are applying it, for example, to agent-based models, which lack a nice, neat specification in terms of differential equations. And crudely speaking, and I've shown this as kind of a straw man or extreme case of this, if you have a dynamic model that is systematically off, and I've shown one here that's grossly off, and you have data coming in over time, as shown here with these bars here, what's going to happen is the dynamic model between observations is going to be projecting. It's going to be anticipating not just a single point estimate, but there's going to be essentially a set of particles, each of which is going to have some theory about the world, and it's going to be stepped forward until a new observation comes in. When a new observation comes in, those estimates, those samples, as recorded by these particles, will be updated and will undergo a process of reweighting and potentially resampling, which will lead to a survival of the fittest. The fittest ones survive. This is sort of brought back to Earth by this new data coming in, and then the model can proceed again with its estimates. New data comes in, it's regrounded there. And fundamentally, this new data coming in can keep this model in check. It's kind of as if, you needed to walk from here to your hotel. You have some crude idea how to go, but you can look down every 30 seconds or every minute at your smartphone and see where you're at. And that allows you to correct any deviations and get back onto path. And that's what this is doing. The dynamic model can still be used to project forward between these observations, which the data by itself doesn't do, but it's kept in check in terms of its assumptions by incoming data, and to a degree can be said to kind of learn from that data. So running models like this, you get out distributions over time, and after the last point, say this point 5 where we last had data, the model's predictions may be quite diffuse or maybe more sort of tight depending on the situation, but you get out a distribution until the next data point comes in. If there's no next data point, it will just project forward, and you can sample from these so-called posteriors for the latent values going forward. So unfortunately, time prevents me from talking about this in detail. This is a technique which is built on importance sampling. So each particle is associated with a weight, and that weight reflects the fact that it's hard to, we don't have a closed form expression at the posterior, and so each particle can be associated with a weight in a fashion that draws an importance sampling in order to allow us to sample from that posterior by using that weight to encode something like the relative likelihood of a given particle. And we resample periodically at an observation to correct the data by reweighting each particle in accordance with how the degree to which it accords with the data, as described by a likelihood function. And the idea here is that at these observations, things are corrected, and we do so using a likelihood function. In this case, we were making use of a very simple approach called the condensation algorithm, which is extremely widely used, probably the most common particle filtering type approach, which is particularly simple to apply. You simply update the weights at the point of observations by multiplying them by a likelihood function, and then you go through what's called a resampling step to draw anew from the particles. Very powerful, very general technique, and I wish I had time to go into it more. I'd be happy to answer questions about it later. This technique, we've approached many specific health problems. These include work H1N1, for example, in Manitoba. Here, a case where we've observed data through time 6, and we're checking the degree to which the samples from the posterior of the model match up with empirical data for later times, which were not used in particle filtering. We've also used it for West Nile virus, for looking at mosquito populations, TB, and pertussis in collaboration with Alberta Health Services. We further combine it with agent-based models that represent ground truth in order to see the degree to which the particle-filtered model, even one that's systematically off, matches underlying ground truth that's obtained from an agent-based model that's considerably more complex. So the idea is that we have a rough and ready model here that could be assembled together quickly on the fly, such as for an emerging outbreak. We have some much more complex underlying epidemiological reality. That underlying model feeds in data that's noisy, that's incomplete. We feed it into a particle filtering context, and we see the degree to which this particle filtered model, being constantly kept in check by new estimates, how does that compare with the synthetic ground truth, the actual situation in this agent-based model? So here we're using an agent-based model to generate the synthetic ground truth to judge our strategy associated with particle filtering, another model. And what we found is that it actually can greatly enhance the accuracy of that underlying model. It can reduce by factors of more than 2 the level of inaccuracy seen by that model as judged through a simple sum of squares type error metric. We've also done this through H1N1 cases and found that a particle filtered model, much more than a recalibrated model, can better predict future evolution of an outbreak compared with a model that's simply recalibrated every time new data has come in. So it's a very promising technique based on this general approach of particle filtering that's very effective. One thing I will say here, and for those in the audience, I think collectively within this audience, we have 4 people who are materially shaping evolution of 4 different agent-based modeling platforms. And one thing I will say is that agent-based modeling is a great tool. It's our foremost simulation tool, but using it with particle filtering, having a particle filter where each particle has a full state of an agent-based model as part of it, is very painful using today's frameworks. It is very challenging to use today's frameworks in this fashion, and I was delighted to hear Jonathan earlier mention the investments that Repast is making that might make this sort of thing possible, because it's an extremely powerful technique. It's one that we've done at considerable expense by hand, having a situation where each particle has an entire theory of the world is captured by a complete agent-based model, all running simultaneously and being updated at observation points. But doing it in Repast or doing it in ModGen or doing it in AnyLogic, I think right now is going to be very challenging from our looks at the APIs involved. And I think this is an area where the existing frameworks can be really enriched to help them better make sense of the data. Okay, time is running short here, so I'm going to need to engage in some significant triage here. I do want to talk just very briefly about this issue, this provocative question, whether microcontact time series, such as we get for big data, such as from IEPI in our case, To what degree are they a luxury? To what degree are they something that allows us to build more robust models with extra confidence? And to what degree are they absolutely necessary for those models to actually be used in a reliable fashion? And we've conducted several studies which shed light on this. I'm not going to be able to do them justice here, except to say that we make heavy use of what we call data knockout experiments. The idea here is we have all this data coming in from these time series from our phones, and what we do is, for some of these experiments, we knock out a lot of that data. We pretend as if we only had data coming in every hour or only once a day. And we see the degree to which the results that we would have obtained with that lower data rate, that lower sampling rate, are compatible with, to what degree they diverge from what we obtain with a very frequent sampling rate. And we've conducted this at several different levels that I'll just be highlighting briefly here. So the particular context we've looked at is one that's very important to us, given our close working relationships with a variety of parties within our province, looking at infection transmission here. What we're specifically interested in is the degree to which microcontact data on contact patterns, really informs the policy discourse more than traditionally sampled data. And in this case, what we had done is we had taken data from IEPI, from these microsampled data, and we had actually aggregated it up, for example, to contact graphs that are static, at least static for the course of a day, for example. And we examined the degree to which the findings of a model would differ from either a static network or the microcontact data network that we actually had in place. And we did this for a variety of schemes that took into account different sorts of days and different sorts of network matches. And what we found actually is that the full detailed simulation gave results which were actually were quite different and actually outside the bars of these whiskers here from what your conclusions would have been with these other types of more aggregated approaches to the data. In other words, that extra level of detail in the data seemed to make a very material difference in our estimates of the number of infections that would have taken place. And this is a published paper, which you can go find, but fundamentally it shows real gaps between what we would have thought would be the case if we had sampled only infrequently and what we actually found with more detailed data. A more provocative study yet looked at this issue of how frequently we have to sample. And what we found here is that if you're only sampling every 3 hours, for example, you're going to be fooling yourself about the network structure. You're going to be thinking there's a lot fewer contacts than there are, albeit more persistent contacts. And you're going to really underestimate the degree to which infection will spread in that population compared to the case of the level of resolution you have if you're sampling every 5 minutes, which exposes lots of short but potentially important linkages, say, between different areas of your network. So this issue of how frequently we have to sample, it's not merely enough to say sample, well, once a day. That's much more than traditional EPI requires, and that's good enough. Actually, sampling down to the sub-hour level seems to be pretty important. We have refinements of this result, but the general picture remains that you need to go below the resolution of an hour for certain types of conditions. And this does vary by condition. If you have something like TB with a very long latent period, it's going to be sort of aggregating over these periods, and you don't need that level of resolution. If you have something like Norwalk virus, it will very much make a difference. So, in short, model representation of contact dynamics, and whether it's at the level of resolution of sub-hour or a much longer resolution, can really make a difference in terms of our model findings. Okay, just a few comments and conclusions here as we're running to the end of the hour. So sensors are increasingly ubiquitous, and commodity sensor-bearing devices can now serve as a very versatile platform for collecting sensor data, as well as micro questionnaire data and crowdsourcing, for proactively indicating things such as exposure to adverse environmental conditions, to messaging, subclinical symptomology, etc. And moreover, all around us at any given point, there's all sorts of signals. GPS signals, GPRS signals, signals involving Bluetooth, Wi-Fi, cell phone towers, etc., that clue us into where we are, with whom we are, etc. And coupled with models, sensor data can offer really significant and complementary health insights. It can really help ground those models and take the microdata depicted out of the models out of the realm of speculation and put it into a much more grounded context. But it needs to be linked with a stack of reliable tools for inferring health behavior from this sort of data. Now, cross-link sensor-based and EMA data, as well as other components, offer a lot of potential to sharpen traditional methods. Machine learning techniques, in particular, such as those that I've listed here, everything from hidden Markov models and support vector machines up to the areas of particle filtering and MCMC, can really substantively enhance the power of dynamic modeling. And a key use of this data that I see as being of great potential for social and health policy is to learn more quickly from interventions, to understand which pathways are being successfully nudged and which are not, so that when we have an intervention that's a failure, we can know why it failed, and through comparison with models, have some clue, with dynamic models, have some clue as to how to improve it for other contexts. So that's all we have time for with the presentation, and I'd like to thank you for your patience.
Thank you for a very stimulating talk. I think we have time for a couple of questions. Sally?
So you talked about using the agent-based model data as synthetic ground truth.
Yeah.
What about ground truth in the agent-based model? Did you talk about that?
Oh, so serving for the agent-based model.
Validating the agent-based model.
Yes. Oh, yeah. We so that's. I'm sorry, I didn't bring that up more, but that's absolutely a central point of what we're doing. So, with an agent-based model, very commonly we either parameterize it with data that's derived from machine learning models, for example, by using machine learning models to arrive at transition matrices, which would go in for parameter estimates in the agent-based model, or by using it from the machine learning models to infer possible parameter values. But another big use is if you have time series of data where you have health behavior that's been deduced by machine learning models, you can try to calibrate the agent-based model to that data so that it best matches the observed health behaviors empirically. I'm not sure if am I addressing your question there?
Partly. That's
okay. We could talk more offline. Okay.
Yes.
How are you incentivizing?
Well, we've looked at several different approaches and have successfully applied. So this has been used in dozens of studies now. In some cases, we give it to people who are actually compensated. So they're compensated often in a fashion that reflects compliance, so their willingness to answer micro questionnaires, et cetera. In other cases, we particularly use this quite a bit with vulnerable lower income populations for studies such as gestational diabetes. Studies look at smoking in 3 low-income communities in Massachusetts with American Legacy and Harvard. And in these studies, we also provide incentives. Instead of monetary ones, we provide phone plans. So people's phone plans are paid by us, and as a result, they don't have to worry about data caps and overage fees and so on, and we can collect data through there. In other cases, there have been volunteers who have offered to, and yet other cases, what you have driving it is there's community groups really interested in the data, and so a lot of the incentive has been providing the data back to the community and to those individuals to serve as sort of a more perfect mirror of their behavior. And the idea being that if you're dealing with something like regulating your blood glucose level, taking insulin and its relation to sedentary behavior and physical activity during pregnancy, providing that information back to someone might help, for example, the woman to better understand how she can keep her blood sugar levels in check. And that's been a big use of our sort of a big emphasis in our work recently, is sort of providing data back to people so they feel invested and feel a sense of ownership over the quality of data coming out. So this is some comments.
So the input
Yeah.
to the model, to the data, are then subject to all sorts of selection bias. And then
Yeah.
so there's a generalization issue from the data, but also all sorts of uncertainties associated with the features of the model, which I didn't have the sense came into either the Bayesian updating or the filter. Am I missing something?
Right. So well, I think you're bang on, and this is something that that many of us are grappling with the issue of big data, and there's some glib words that are sometimes said about it that I don't buy into. That the volume of the data overwhelms its non-representative nature, and somehow by having lots and lots of data, it's going to be more representative. And I don't believe that one whit. I believe that a lot of the data that you're dealing with from devices, for example, or data gathered through other conduits of big data, social media or what have you, there are real biases associated with classic concern in epidemiology, associated with selection of the participants, et cetera. And, we have tried in our work to use certain types of classic methods to select participants that will be more representative for certain types of studies. And, in some cases, we're working with people who have been selected as part of randomized controlled trials, for example, which is a much more well-defined group. In many cases where this is used ecologically, there's not that sort of cross-check and turn, and you have to be very careful, particularly if you're running it on participant smartphones, to not disenfranchise very vulnerable groups of people who can't afford, the luxury of having high cap data plans. So I don't think there's any magic here as far as that classic question. What I'll say is that we're grappling with it in a traditional way and don't have a lot of new emphasis, beyond what's needed for classic epi studies. I think along those questions. Because of the time, I may have to talk with you about the question about the models, because I didn't follow that as closely.
I just wanted to point out that the recording from smartphones and a whole bunch of technical issues are very closely linked to what Arjun Misra will talk about tomorrow afternoon in a totally different context. If you're around, it would be great for you guys to interact. He's going to describe a smartphone network that we have running in Singapore on the campus of Singapore Management.
Right.
Where a number of the issues, the recording issues, are closely linked that they work on.
Fantastic. I'll try to be in contact with them to learn about that. I'm grateful for the reference, and thanks.